It's on.
Oh, are we recording? Okay. Hey guys, Katie here. I'm going to show you how I set up the room before I do an abdomen upright. So what I always do first is go ahead and angle my tube before I move it. It's just easier that way. I'm going to bring it in and detent it to 40 inches SID. Hear the clicks, you're detented. Then I'm going to line the tube up to the bucket. Right, there we go. That's how you know you're lined up. Crosshairs, good to go. Now I will adjust it according to patient height when I bring my patient in here to do the exam. Miss Contreras?
Yes.
How are you today?
Good. How are you?
Good. My name's Katie. I'm with Southern Regional. I'll be doing your exam today, okay? Now, can you verify your name and date of birth for me?
Pamela Contreras, 08/14/1984.
Thank you. And do you have a bra or any jewelry above the waist?
I do.
Okay.
I'm a bra. I'm a ear. No,
Good.
no ears.
I'm going to need you to remove all that and I'll put you in a gown.
Okay.
Any chance you might be pregnant?
No.
Okay. So to start off this exam, you're going to be standing. I'm going to have you put your back against this board, okay? Ms. Contreras, I'm just going to feel on you for some bone, okay? Move my arm down to my centering point, which is 2 inches above the iliac crest, so I can have diaphragm. I have to have diaphragm in the upright. Ms. Contreras, can you move your arms out for me? Thank you. Just lining the tube up to the IR. That's what I'm looking at to make sure it's lined up. Feel on you one more time just to make sure. You can relax your arms down. Marker to know which side you're on. Usually just pop it on there. All right, Ms. Contreras, taking a deep breath. Blow it out. Hold it out. Expose. You can breathe.
Roll.
Okay, Ms. Contreras, now we're going to move to the table to do your next image. I'm going to need you laying down flat on your back, okay? Just give me a moment while I move around my equipment. Okay, so now I'm going to move my equipment around. I'm going to make sure I'm detented to the table. And then I have to line my tube up with my IR. There again, you see the light. That's how you know you're lined up. Pop that bad boy in. Okay, Ms. Contreras, my table's gonna move up. Feel on your side again for your bones. This time we're going to center at the iliac crest. Okay. Now in the upright, we wanted to make sure we had diaphragm. In the flat, in the KUB as we call it, we want to make sure we get pubic symphysis. Now a way to make sure you have a hard time feeling for the crest, touch the side of their leg, have them turn their leg in and out. You feel the greater trochanter of their femur moving. It's perfectly aligned with the pubic symphysis. Right there. When I do my KUBs, I always put my marker on the IR in the buggy. It's always sure to show up. Okay, Same breathing instructions as before. Ms. Contreras, take a deep breath in, blow it out, hold it out. Expose, you may breathe.
Now.
Okay. Because of Ms. Contreras' small stature, I did a lengthwise, because that should catch pretty much everything: kidneys, ureter, bladder, pubic symphysis, everything. Some patients are very broad, and you might have to put your IR in here crosswise, like this, and then take 2 crosswise images. So you'll take one lower with the pubic symphysis, go up higher, get the kidneys and the ureters. That's it. All right. First, we're done. Please hold tight while I move my equipment out of your way so you can be done. Right, you can go ahead and sit up. You feel dizzy or anything? Are you okay?
Yes, I'm good.
All right. Ready to go.
Thank you.
Thank you. Have a good day.
You too.
All right.
Okay. All right, this is an x-ray film of a KUB, as we call it. This is the supine abdomen, where you're looking for your kidneys, ureters, bladder, and you have to have pubic symphysis on it. And that's basically all you're looking for. It's hard to see actual kidneys unless you have contrast. Now you can see the kidneys very well, and the ureters. Kidneys, ureters, bladder, pubic symphysis. It's much easier to see with the contrast. It gives you a better idea of where the kidneys are. That way when you do one without contrast, you know you got them in there. Then we come over to the erect abdomen, the upright. This one you want diaphragm, and that's basically it. Diaphragm down, whatever you can get into it. You do not have to have the pubic symphysis in the upright. Here is a more labeled x-ray of what all should be in the upright abdomen.
Mr. Johnson? Hi, how are you? Can I have your first and last name?
Tyler Johnson,
Okay, and your date of birth?
May 15th, 1998.
Okay, my name is Pamela, and I'm a student with SRTC, and I will do your shoulder today, correct? All right, let's come this way. I'm gonna have you put your back against the board. There we go. And is it your left shoulder, the one that we're doing today? All right, let's make sure. Thank you. Okay, so we're gonna go ahead and put your back against the IR. I'm gonna get your shoulder. I am going to make you move a little more. There you go. Take a step down. Okay. And we're gonna put in the middle of the leg, 1 inch inferior for the coracoid process. And then I wanna make sure this is a neutral position. So his palm is gonna be against his thigh. I am going to place my marker away from the anatomy and the way that the patient is facing, which is facing out. All right, Mr. Johnson, if you could take a deep breath in and hold it, don't breathe, don't move, click and breathe. Thank you. All right, sir. The next one we're gonna do, we're gonna have you put your arm on top of that shoulder right there. Okay, and I'm gonna turn you. There you go. Alrighty, I'm just gonna move the board behind you, okay? Give me 1 second. I'll make sure that I'm lined up. Alrighty. Place my marker away from the entrance. There you go. Alright, sir. I'm gonna open up my collimation to make sure that I don't miss anything. There you go. All right, sir. So I'm gonna have you take a deep breath in and let go. Hold it, don't breathe, don't move. Beep. Done.
Make sure that we have a good x-ray and have what we need in it. For the AP shoulder neutral position, the greater tubercle is partially superimposed over the humeral head. The humeral head in partial profile. Slight overlap of the humeral head on the glenoid cavity. All right, for the lateral view, which we call the Y, because it looks like a Y, the humeral head will superimpose the scapula. And the scapula, you want it straight like this. Look like a toothpick. And if it looks like a Y, you did good. Just a little side note for you guys. The Y view we did for the shoulder is something we learned in clinicals. It's something we do in the clinical setting. It is not in Merrill's. So don't try to look it up because it's not there.